Hi there, good afternoon. I am Dr. Chung and welcome to your friendly proctologist. Welcome back to this space, this channel where we discuss many private and sensitive issues. And I wanted to bring you some helpful and useful information so that whatever situation you may find yourself in, this will help you to make some decisions for yourself. Today I wanted to discuss some situations which have been weighing on my heart, and I find that many people, when they get into bottom end problems, they just don't know where to turn. They don't even know who to see, and who can blame them? No, not everyone's an expert in the field. And so what they do is they go to the emergency room. Where else is there to go, right? I mean, the emergency room will have everything there for you, have all the specialists there. What could possibly go wrong, right? But unfortunately, not everyone has a great outcome. And I wanted to list some reasons as to why the emergency room may not be the best first step. And maybe seeing someone or seeking out someone like myself, a colon and rectal or proctologist surgeon, may be a better option than just going to the ER. And I have a list of things here based on all the stories that I've been hearing, because I hear these stories every single day, unfortunately. So let's go through it, shall we? By the way, these are on no particular order, so let's take number one. And the fact that there is really no sympathy or empathy given to you. Now, of course, the emergency department does not do this on purpose, but it's just extremely busy. And, unfortunately, the human connection gets really missed in all their business and the length of the time they have to work. So that human connection is lost and people don't feel like they're being taken care of. Yeah, you may get a medication or something helping you of it, but you certainly don't feel like you're completely whole and you were taken care of, really, at the end of your visit. And versus going to an office like mine where we can have a one-on-one conversation. You can have the time to ask your questions and have a good treatment plan and even follow-up afterwards, right? When can I see you again to make sure that things are okay? Number two, the physical exam, whether it's with the finger or even looking, just pulling apart the skin or using an anoscope of some kind, may be crude or even rude. That's why I always ask, or always recommend you ask them, do you know what you're looking for? What are the possible things that could be going on? Are they able to recognize it? He or she, whoever the practitioner is. Because if they don't know what they're looking for, then, and if you're having pain already down there, it may cause your pain to be worsened. And if someone else is going to come, a specialist is going to come and take another look, what was the purpose of going through that exam more than once? And coming into an office here, you may find that for me, myself especially, for example, I'll speak for myself, is that sometimes I don't do an invasive scope every single time, especially when they have pain, because I don't want to make things worse. Many times I can diagnose things from the outside, and I'm quite good at this just based on my experience. And I've spared you a lot of discomfort. I show you that I care and I'm listening to how uncomfortable you are. And it just makes for a much better time. Number three, the ER may not have a good answer for you. And with hemorrhoids especially, there's the treatment for a non-specialist, someone who's not trained like I am, may not have any options other than maybe a cream, or they say, you know what, you just need to go home and rest your hemorrhoids. I've heard that many times. And you know, the ER staff, they have to be experts in many different conditions, and hemorrhoids unfortunately isn't really on top of their list. And so to go through all that time waiting in the emergency room, in the waiting area, and then being in the room, being, you know, examined and probed possibly, to only be told, I'm sorry, you need to go home and you need to see a different doctor. There's nothing we can do for you here. I mean, I can't tell you how I feel for these people when they tell me that, because I'm often many people's last resort, because they've gone through all the steps of the ER, urgent care, gastroenterologists, etc. And it just, you know, it really is a sad situation, because they've been suffering the entire time. And so let's go to number 4. You may not be the highest priority, and yes, you're in pain, you're in great discomfort, and everyone knows that. Certainly they realize that based on your story, but again, that connection and that communication to you, to that, their emotional availability to say that to you with empathy may not be there. And when you're prioritized with someone who's got a heart attack or a stroke, you're kind of lower on the list, and they will get to you, but the amount of attention and resources that they have is simply just not available, right? And again, I'm not trying to blame the emergency department. It simply is the fact and the environment of how busy and crazy it can be in that department that unfortunately you may feel or perceive that as something negative to yourself. And I just want to say that you know, here in the office, if you can seek out a specialist like myself, the difference would be that everyone here, when you got that one-on-one time, you can feel like people are listening to your individual story and you're getting that connection again. Number 5, the emergency department and many other departments in healthcare today are being measured by metrics, right? There's patient satisfaction. And in the ER, there's things like wait times, which have to be short as possible. The time that a patient spends in occupying a room in the ER is also measured, you know, and that has to be shortened as much as possible. They want people in and out and moved on to the next level of care or sent home, wherever that may be, as soon as possible, and that's tremendous pressure on the staff. And so when someone who has a hemorrhoid issue, for example, who's lower on the priority list, and they know they've seen patients like you before, they know that there's nothing much that they can do. Unfortunately, sometimes some people are just, they feel like they're being shoved out. Like they didn't even get a chance to really feel like they're understood, and they're just pushed along and told to go home. Here's a cream, see you later. Certainly understand that, and it's unfortunate that many ERs don't give that feedback to you where you are important, but it's you know, everything can use improvement, and I think for bottom end conditions, that's something where it could use some improvement. Number 6, another reason not to go to the ER immediately is because you may not see a specialist like me in the emergency room. So you may have a surgeon consulted, is what they call it. An emergency doctor sees you, says, you know what, you need a surgeon, and so they will call the surgeon who's on call at night in the hospital or during the daytime. Unfortunately, the surgeon may be a general surgeon, someone who hasn't had the extensive training that I have had. And how that impacts things is that I've seen many patients with hemorrhoids who unfortunately do not get offered a procedure to help them to get their recovery on the road faster. And it's unfortunate. It's sad because, you know, they have to, there's something that could have been done, right? And that's always the thing is, you know, could there be something that you could do for me in my situation of helplessness and pain? You know, please help me. That's why I'm here in the ER. But unfortunately, sometimes the doctor just doesn't have that expertise, doesn't have that experience, and won't be able to offer you something. Whereas if you came into my office, and it's happened so many times here, I can't even count. Patients will call me from the ER and say, "Doc, I'm here, and they just told me that there's nothing they can do. Can you help me?" You know, they're looking up on Yelp and Google, and you know, or they're given my name, and I'll tell them, "Yeah, I can help you. I can do something for you." Or at least get you some help, talk about your habits, try to figure out how to get things corrected and get you on the track faster. And that is something that I've been wanting to get off my chest for a while. Certainly, again, I just want to put this out there. I'm not trying to dog the ER emergency room. I'm not trying to talk bad about them. I mean, I've been a patient of the emergency room myself, and certainly I've been in the emergency room and have experienced that environment, and I understand how difficult that job is. But at the same time, there's always room for improvement. And when we talk about in terms of our bottom ends and my specialty, you know, having some other options to think about, to research, may be of use and could spare you some heartache, is really what it is. Well, I hope you found this video helpful, and try looking up a colon and rectal surgeon or a proctologist. And so definitely give someone like me a try before maybe just going immediately to the emergency room. We may be able to help you more than the emergency room can. Thank you so much for watching today. I appreciate your time. I appreciate your comments as well. More videos are coming. Please like, subscribe, and ring the bell, and I'll see you next time. Bye-bye.